Okay. Which of the following complications is this patient at increased risk for? A 50-year-old woman with a history of dry eyes and dry mouth presents with fatigue and joint pain. Laboratory tests reveal positive anti-nuclear antibodies, ANA, and rheumatoid factor. Further testing shows positive SSA-RO, or anti-LA bodies. Which of the following complications is this patient at an increased risk for? So it's just Sjogren's disease, is what they have currently. And so what does Sjogren's disease have an increased risk? Like, what is likely to follow with an increased risk of when you have Sjogren's? And I don't know. Hepatocellular, non-Hodgkin's, renal cell carcinoma, multiple myeloma, or AML. I don't know, man. I'd probably go AML. That's probably where I'd go, but
Okay.
I'd be a guess. So I don't even know where I like could go with this. It's just like to me, it's like this is like you know it or you don't, right?
Sure. What did you get your diagnosis as?
Sjogren's disease.
Okay, good. Sjogren's. Okay. It is kind of you don't, but okay, you're gonna go with E.
I probably would just guess E.
Okay. It's actually non-Hodgkin's lymphoma. Okay. This is gonna be your best. I'm gonna explain this to you, and so you don't have to memorize it. Usually these are, I think these, I want to say these are B cell, if I'm not mistaken. Yeah, like a maltoma. Okay. And the way you remember that is that Sjogren's, when you take a look under the microscope, you see a lot of B cells because of the inflammation. And it's very similar to this. I'm going to kind of relate it a little bit slightly off topic, but the same. Hashimoto's is the same thing. It increases your risk of non-Hodgkin's lymphoma or B cell lymphoma. And the reason why it is if you look under a microscope and during Hashimoto's thyroiditis, right, you're going to see a lot of B cells, which that makes sense, right? That if you continue it, then you're going to have an increased risk of B cell lymphoma. And that's the same thing with kind of Sjogren's. You get a lot of inflammation, which all these autoimmune disorders of the mouth, the thyroid, things that increase your risk of like B cell lymphoma.
I just
So,
did okay. Oh, yeah, that's good to know.
yeah, that's just how it looks like under the microscope. That's how I remember it. So, yeah, that's the
Okay.
best